September is PAD Awareness Month, which stands for Peripheral Artery Disease. You may not be familiar with it, but millions of Americans are suffering from it. Today, I'm joined by Dr. Ryan Jean-Baptiste from Modern Vascular to tell us a little bit more. Thank you so much for joining us today.
Thanks for having me. I really appreciate the opportunity to come on and talk about this very expansive disease process that's affecting millions of Americans. Approximately 10 million Americans actually are suffering from peripheral arterial disease. And the sad part about it is that there are so many more that are probably being affected with it, but haven't been diagnosed. So it's extremely underdiagnosed and undertreated.
Yeah, and I am actually not familiar with this disease, and I'm sure many of our viewers aren't either. So what is it exactly?
So I like to think about it in very simple terms. It's your heart pumps blood all around your body, and it's simply like plumbing. The arteries in your legs get clogged, and that leads to symptoms such as difficulty with walking, pain at night, and then ultimately some people go on to progress to having wounds on their feet that won't heal. And specifically with patients who are diabetic, right, also develop neuropathy from this, which is a numbness and tingling that can happen.
Wow, that is, very scary. And, after diagnosis, what are some of the options for treatment?
So the options for treatment are surgery, which nobody really does anymore, and there are minimally invasive treatments, which is what I do. I go in through small holes in the artery and clean out some of the plaque and then stretch out a vessel. Sometimes I put in a stent which stays inside the artery to keep it open, right? And the thing that I'm especially known for is going all the way down into the foot to treat the foot below the ankle to bring the maximum amount of blood flow down into the feet for patients, especially who are diabetic and have non-healing foot wounds.
Oh, wow. But does it always involve a procedure?
No, about 50% of the patients who come into Modern Vascular actually don't wind up with a procedure, but it's very important that you get screened for peripheral arterial disease because some people have low levels of disease that can progress, and so you need to be monitored on a consistent basis.
Right. And, for someone who's watching who might think they have this disease, what should they do?
So the first thing you should do is you can go on to www.modernvascular.com and take a very simple quiz, and it'll go through some symptoms and some risk factors that you may have. If you score high enough, you can call us on the website and get in contact with some of our specially trained personnel who can walk you through the process of getting scheduled for a consult, right, where we'll see you, evaluate you, do a physical exam, probably do an ultrasound, and if you have disease, we'll go on and see what we need to do in order to treat you.
Right. And then obviously you sound so passionate about your work and you're helping so many people. So what's the most rewarding part of, working at Modern Vascular?
Well, one of the biggest things for me is that as an African American, this disease process affects us almost twice as often as people who aren't of color, right? And then the biggest thing for me is also preventing amputations, because unfortunately, if you wind up with an amputation, after 1 year, about 50% of those patients actually are deceased. Wow. Right? And the really sad part about it is up to 90% of those amputations are preventable, especially if you come in and see us early and get treated well before you wind up with any wounds on your feet.
Wow, that is insane that this can be so preventative. So definitely, give them a call today. And where can we get some more information?
So like I said, on the website, www.modernvascular.com, go on there and you'll see the information for the Louisville clinic that's going to be opening up here on the 14th of September at 2000 South Hurstburn.
All right, awesome. Well, thank you so much for joining us today.
All right, thanks. Thanks for having me. Appreciate it.